I feel like I need to talk a little bit about this Medicaid issue that's in this big, beautiful bill. I was watching Moses Mike defending kicking people off of Medicaid. His defense was that there are illegal immigrants that are on Medicaid that should be used for people that are citizens. That isn't entirely true, unfortunately, Moses Mike. First off, it's not true, and second of all, gee, how Christian of you to kick people off of health care. But let's talk about this for a minute. Federal law requires emergency Medicaid to be applied to anybody, citizen or non-citizen. If it's an emergency, you qualify. There are people on Medicaid that are not citizens. They are, generally speaking, except California is an exception, but in other states, they are people that are here with legal immigration status. Refugees that are allowed to be here, people that are going through the process, asylum process, people that are going through the process to become citizens. They have legal immigration status, green cards, whatever it is. And generally speaking, they have to wait 5 years before they can apply and be on Medicaid. Okay? Look it up, guys. Now in California, we decided that people without insurance was dangerous for the health of our state. And it is dangerous. If you don't have insurance and you get sick with a contagious disease, you're not going to do anything about it until it's an emergency. And then all these people around you are going to be infected. It is an issue. I used to be a working RN. I'm retired now, obviously. I worked in case management for quite a while. I worked in infection control. When I was working in infection control, we had a patient that was full-blown, almost killed him, TB crisis. He was a Mexican national here without a visa. Guess who had to pay for that bill? And it was quite the bill. The hospital had to eat it. If he had had insurance, this was before California allowed the insurance. If he had had insurance, he could have gotten that little cough taken care of. TB would have been found out. He wouldn't have almost died. He was in the hospital for like a month or two. He almost died. A young man. And then the state had to put him up in a home to be monitored by health officials so that he didn't spread it to the rest of California. If you do not supply Medicaid to people, guess who eats the bills? The hospitals. That means two things. The prices of people that have insurance, their prices are going to go up, and the hospitals will likely go under. That's what happens. I find it absolutely horrifying that Republicans, particularly people like Moses Mike that pretends to be a good Christian man, I find it absolutely horrifying that they don't even know what they're talking about. When they make blanket statements saying that there's too many illegal immigrants on our Medicaid system, there's able-bodied, he kept saying able-bodied white men. I don't know where he's getting this from. I don't know. Generally speaking, if you're able to get a job and you're not making enough money because you don't have skills, you still qualify for Medicaid. It's based on income. How about we give health care to everybody? Hospitals won't go under. Everybody pays taxes, whether you're here legally or not. If you buy something, You're paying taxes. How about we do that? How about we make sure that horrifying diseases like TB don't go rampant in the country because people are afraid to get health care? What a wonderful world it would be if America was like that. Too many people on the Christian right don't believe in helping others. Have a good day.